One of my favorite guests. Well, Paula, why don't you take it away since you got the camera?
Okay, well, we've got the camera over here because we're all just giddy over here with some excitement. Okay, Vitahl is here today. We're going to do a Botox demonstration. We have Holly Martino over here getting ready. We have a registered nurse, Christen, who has done nothing but do these Botox injections for the last 10 years, which is why...
Before we do that, what I'd like to do is just talk to Dr. Vitahl.
Yes, absolutely.
Just before we do that, okay, so go ahead and tell what we're going to do.
I was going to pitch it back to you right after I talked about...
I just want to remind you.
Okay, doing this Botox injection, but why don't we send it over you to Tom, and you and Dr. Humes tell us a little bit about Vitahl first.
We should mention with a free-flowing show like this, we're actually reminding the camera people what we're doing.
Exactly. It's hard to keep up with it sometimes.
That's why we do it. That's why we do it. I mean, Paula knew I was coming over here. But Dr. Humes, last time we had an extraordinary response to what you do. And I'll tell you what people like, and we need to talk about that. You're a doctor. It's a medical spa. Why is that important?
Because you need to have physician oversight so that you keep the safety of medicine in a medical spa.
Now, an oversight. Yeah. Some spas say they have an oversight. I don't want to throw stones, but a doctor passes through every now and then.
Exactly.
You know that. Okay.
Yeah.
You own the place.
I own and I'm on site.
And you're there, and you supervise the injections. And what else do you do?
We do lasers. We do the pearl laser, which you saw last time.
Paula had the pearl laser, and she was very pleased.
Her skin looks incredible.
She was very pleased.
Yeah.
And so we're going to do a Botox demo. And why the demo? Because people I think it's more severe than it really is.
Exactly. I mean, you have to be serious about Botox. I mean, getting Botox, stopping by, getting your hair cut and getting Botox isn't the way to go. No. So you have to be serious about it. But at the same time, it is not a procedure that hurts a lot. It is not a procedure that takes a lot of time. It's not a procedure that you need to be that nervous about. But people are. So I think this is a good example.
Let's mention this before we go.
These demonstrations, Tom, because just like with my pearl laser treatment, you know, people don't understand really what you're going to go through for 5 days, and that's why we want to show every single day what the process is, and that's why we're doing a demonstration.
And let's walk
Botox
over there, but let's
exactly
mention you do skin resurfacing, you do skin tightening, laser, photo facials, you do all kinds of things. Now, are you limited to the face?
No, you can do most of these on the body as well.
Okay, and I don't want to put my back to the camera, but I'll be near Holly here while she gets this done. Now, Holly's never had it done, but what are you doing and why here as a demonstration?
Yeah, I think Holly's a great example of why you use Botox for prevention. Can you smile for me, Holly? When Holly smiles, she doesn't have a lot of wrinkles around her eyes, and that's the area that we're going to treat today.
There are a few, but
very much.
And I don't mean that. I don't mean that.
From coming in.
But you know, everyone has some, right?
Yeah, everybody has some, but this is about preventing them. Once they're
can we show
skin,
before and after? Bonnie, can you get maybe a close-up of around her eyes, and then we can do a before and after? Because will you see a difference? Oh, you won't.
No, it could take up to 2 weeks to see an after.
I thought I thought they work right. It works right away.
But we do want a tight shot. As the nurse, you're a registered nurse. You've been doing this for 10 years, and I think this is important because Vitahl is in the top 1% in the nation when it comes to Botox injections. That's a big deal. So Holly is in good hands here.
There it is. Okay.
But there's none there.
So Christen, can you take us through this and kind of walk us through?
Absolutely.
So the idea is when people smile, those wrinkles stay after they smile.
They do. What happens is you think of the skin like a curtain, and the muscle moves, and that curtain falls into that crevice where that muscle has moved.
So what does Botox do to prevent the after wrinkles, so to speak?
What it does is it weakens the muscle. It weakens that muscle so that you don't make that movement. Now, somebody who has too deep of a wrinkle etched in the skin, there's somebody that we can use it for treatment to soften those wrinkles, but it's not going to make it completely go away.
All right, now we have a friend of ours, Kim, over here. What do we have Kim here for?
Kim, what is it that you're hoping for today?
I have deep wrinkles.
So Kim has had more established creases as a result of smile lines?
Exactly. She may smile more, or it's just, you know,
she definitely smiles more.
Have you ever done Botox before?
So as a result then, will they relax, even the ones that have been established?
Yeah, so can you relax for a second? So see how at rest she has a slight etched into the skin?
Yes,
but they're not very deep, but then when you smile,
well, I have wrinkles etched from years and years.
Botox would be great for you. When are you getting injected?
So do men do it? And men?
Yes.
And what is the you know, the jokes they make on comedy skits about faces being stiff? I mean, that's the whole idea, is to do it in the right area.
What you want to do is do it in the right area. You want to use the right amount of units so that you're softening the look without freezing it up. But I think that, you know, it kind of got that bad rap from comedy, but really, most people don't walk around frozen looking.
All right. Now, will they notice something right away?
No.
Or it takes a long time to get into the system?
Well, it can take up to 2 weeks. What it does is it needs to actually work on those muscles to make them stop moving.
So, So let's at least show the demonstration.
When I would expect.
Anywhere, I always say 2 days to 2 weeks.
Okay.
So sometimes, I know the last time I got injected, actually, I kind of was laughing because I said to Kristen, I said, oh, I actually saw it that night, and you never see it that
All
night.
right.
So can we actually see the procedure while
Let's
you're
do it.
talking
Go
us
ahead.
through
Chop,
this,
chop.
Dr. Humes?
All right.
Yeah. So what Kristen's doing is she's cleaned off Holly's
I'm
skin.
going to re-clean because she's been icing a
Okay.
little bit, so
Right.
I'll
We have
clean again.
Holly ice really quickly just to
Very
shrink up
tiny
those blood
needle.
vessels.
Okay.
Exactly.
Super tiny.
Usually we have, a nice relaxing chair to sit in, but
Right, I understand.
we're going to do
And
bistro
this
chair
is
where
a
you're at.
demonstration, and really what you're trying to show, we talked
Yeah.
about, what we talked about is trying to show that it is not a severe procedure and something that's done in the office. As you say, it's nothing to joke around about, but with someone qualified doing it. And Holly, I really want you to talk about what you're feeling, okay? I mean, you don't have to lighten it up or don't, just let me know what you're really feeling.
Okay.
So what I want you to go ahead and do is give me a big cheese scrunchy grin.
So what Kristen's doing is having her give a big grin so that she can see where that muscle is the strongest.
Okay.
What you want to do is you want to do Botox and you want to inject into the area where the muscle is the strongest
Okay.
rather than
Keep
just,
going. Just stay that way.
willy-nilly.
No, now I want you to rest. Okay. Take a deep breath for me. Just a little tiny pinch, okay?
Most people after this say, wow, why didn't I do this sooner? That was really easy.
Now, she probably
It's a
can't.
mosquito bite.
Was it really like a
a
mosquito
mosquito
bite?
bite.
Okay, all right.
And I just massage them just so the bones go down.
And that was it for that part.
That was it for, and then you'll do
And then you'll do a couple
injections.
more? Okay.
Exactly.
Now, let's talk about vein therapy because I had some emails about vein therapy.
Yeah.
Women especially hate veins in their legs. What do you do for those?
You can either do sclerotherapy or the laser. I personally prefer the laser. What we do is we treat superficially, so from the outside in, and we use that laser to get deep into
And it
those
really
veins.
can cover those veins.
It really does. What it does is it collapses those veins on themselves and the body reabsorbs them.
Do we have any special? Okay, we have to take a break. Can we give a viewer special for our listeners?
Yeah, what we're doing is we're doing a special on Botox since we're demonstrating it today.
All right.
We're doing $100 off Botox.
Oh, that's cool.
Yeah.
Okay.
So for 1 week only. So
All
if
right,
you come
and
in and see
that's
Kristen.
and that's Vitahl.
Very easy.
Good.
Very easy.
Very easy.
Even setting up. And
Now,
then
there's the
you have
information. $100 off Vitahl. It's 303-388-7380 or Vitahl.com, and that stands because Dr. Tall Humes. It's part of her name, and Vitahl
Vitality,
or
right?
Vitality. It's a
Yep.
great name. All right, we're going to take a quick break and come right back with a lot more.